Hi, I'm Dr. 𝗂𝗂𝗃𝗀𝗃 from Gonstead Physical Medicine. Today I'm going to be talking about the TMJ. TMJ stands for temporomandibular joint. It's actually two joints, the left and the right, and it's basically the joints of the jaw. You might hear people say, I have TMJ, I hurt, but actually they mean they have TMD, temporomandibular joint disorder, because the TMJ is the actual joint, and we all have TMJs. In fact, babies use their TMJ even before they walk and crawl. It's the most used joint in the body. So we use it to breathe, to yawn, to lick, to suck, to eat, to drink, and to talk and kiss. So I'm going to talk about some of the anatomy of the TMJ. So if we look at our skull here, we have this white piece, which is the mandible, and it does 4 different motions. It goes forward, it goes backwards, it goes down, and it goes up. So down, up, forward, and backwards. The yellow part is the maxilla. It's a fixed joint, but you can go inside and adjust that joint inside. Next, we have the blue parts, which are the zygomatic bones or zygomatic arches. So ladies, for you who have nice cheekbones, you have good zygomatic arches. In the orange here is the temporalis bone. This is a very important bone in headaches and migraines because there's a large muscle that sits on top of there, and headaches and migraines can affect the TMJ. So if you look at the body, it is right up here. This is your temporalis bone and temporalis muscle. And lastly, but most importantly, is the sphenoid bone. It's hard to see from the outside. It's mostly an inside bone, but it's the one with the red on each side. And if I show you the inside of it, it is a butterfly-shaped red bone, and it houses most of the neurovascular structures on the inside of the skull, and the pterygoids attach onto the sphenoid muscle. Sphenoid bone. We will be going through the pterygoid muscles in detail in another video. Lastly, we have the disc. There's one on each side. It's this clear piece. And just like the discs in our spine, the disc of the TMJ absorbs shock. So that's shock from talking, from biting, from chewing. And if you wear away the disc, which is very possible to do, then you'll have bone on bone, the mandible onto the temporalis bone, and that becomes very painful. So it's important to take care of your TMJ. Next, we have the nerves. The nerves are 3 different sets. You have the mandibular nerve, which contributes to all the functions of chewing. We have the vagus nerve, which attaches onto the neck and courses all through the body and inserts onto the diaphragm. So the vagus nerve is a very parasympathetic nerve. It causes us to relax, to digest. It helps us fight anxiety. And it's involved in the TMJ joint because if we have anxiety and stress, we tend to grind, and that wears away the disc. There's also the cranial nerves, which mostly attach onto the brainstem. However, 9 of the 12 cranial nerves affect the TMJ joints. So those are the nerves. Next, we have the ligaments. There are 3 sets. They attach from the mandibular bone to the temporalis bone, from the mandibular bone to the styloid, and the mandibular bone to the sphenoid bone. And then lastly, the muscles. The muscles, we've got the mandibular muscle, which again is very involved in anything involved with the jaw. We've got the temporalis muscle, which I talked about in headaches and migraines. And then we have the sphenoid muscles, which is the lateral and medial pterygoid. So the lateral and medial pterygoid are involved in opening the jaw, closing the jaw, and moving side to side. And we will go through some of the exercises that you can do for your pterygoids in another video. We talked about the discs, the ligaments, the nerves, the bones. That's it for the anatomy. I'm Dr. Suquan Paisano for Gonstead Physical Medicine. We will be talking about some of the things that you can do to prevent TMD, to treat TMD, and of course, if you need any further help with that, we're here for you in Phoenix at Gonstead Physical Medicine. Thanks for joining us.